Marco,
Okay, yeah, we can start. So, good evening,
would you
everyone.
like to introduce the meeting
Yeah,
and
today
then we're ready to go?
yeah, today, as you have seen, we have a very special guest, the Honorable Tony Clement, who served as Health Minister in Canada during the SARS pandemic and Industry Minister during the financial crisis of 2008, and Member of Parliament as well. So, thank you, Tony, for joining us. And so we have a couple of questions for you. Maybe Ludovico can ask you
Sure.
something about the situation. So Ludovico.
Yes, thank you, Marco, and thank you, Mr. Clement, for being with us tonight. It's a pleasure, and it's also a great opportunity for us to better understand what the situation is in Canada and in North America. So first of all, I'd like to ask you what kind of policies have been adopted by the Canadian government? How are you facing the coronavirus crisis? I read about 3,000 deaths and almost 50,000 Canadian citizens have been already affected. So the situation is not like in Italy, but it's not a good situation also for you. So what kind of policies have been adopted? And secondly, could you help us to understand how the US, the United States government is handling the whole situation? As you may know, the American reporting is object of bias reporting by a large part of European mainstream media. So therefore, it's very difficult for our youth to understand how things are really happening and what's really happening in North America, in the United States and Canada. So thank you again for joining us, and please.
Thank you for the opportunity, Ludovico, and thank you, all of you, for allowing me to participate in this dialogue. It's a real thrill to be with my Italian friends here. As you know, there's many Italian Canadians, hundreds and hundreds of thousands who are really a mainstay of the Canadian economy. So it's always good to talk to my Italian friends. Yes, let me first talk about the Canadian situation. You're quite right in terms of the mortality count. We're over 3,000 deaths, unfortunately, and the caseload has peaked and flattened. As you know, it's the same curve that Italy faced and other European countries, where at the start of the outbreak, it was almost an exponential rise in cases, but there has not been an exponential fall in cases, although we are at the stage now where there are fewer cases in most areas of the country every day. We have 10 provinces in Canada. In some provinces, it's not an issue. The province of Saskatchewan, which has over 1 million people and probably is about 10 times the surface area of Italy, has had four deaths, and they're actually looking at opening up their economy quite quickly. Same with one of our islands, Prince Edward Island, which is a province, has had very few deaths, and same in Newfoundland. The biggest problem are in the provinces of Ontario and Quebec. In both cases, the outbreak now is primarily in long-term care facilities, nursing homes, old age homes, whatever your terminology is. I think in Ontario, 79% of the cases are now were traced to nursing homes. And primarily that was because of, unfortunately, the staff who would work in these nursing homes would carry the disease in. They had 2 or 3 jobs. They'd go from institution to institution, and before you know it, you had an outbreak. So I think that there's a feeling that the curve has flattened, and a lot of the discussion now is on how to open up. And this is the purview of each province. Prime Minister Trudeau doesn't have the ability to say we will open our economy this way. It's each province gets to decide. Each province runs the healthcare system in each province with federal help financially, but the actual decisions on how care is administered are done via the provinces. So in the province of Ontario, where I reside, the premier of the province has made it clear that we need a full 2 weeks of stable caseloads, dropping caseloads before any economic opening will happen, and that it will happen in stages after that. And that's a similar approach, except in the province of Quebec, where they are being a bit more aggressive. They have the most cases, and as befits the province of Quebec, because they like to do things their own way, they are opening up more quickly than other provinces by and large. So that's the situation in Canada. Now we get to the United States, of course, which has over 1 million cases and 60,000 deaths to date. And we watch that very closely, of course, being their northern neighbor. I should mention that a new report just came out today. By far, the cases that migrated from elsewhere to Canada, by far the overwhelming number of those were from Americans, not Chinese. In Ontario, I think the initial caseload was 1,200 cases in between January and mid-April. And out of those cases, 400 could be traced to the United States, and it was something like 5 from China. So this is just new information that just came out today, but it illustrates how difficult it is when you have a border that is 3,000 miles long, I don't know, 8,000 kilometers long, how difficult it is to contain something, even if we knew that it was coming from the United States. So the United States has community spread pandemic. There's no question about it. Now they've done incredible amounts of testing, which means, as you know, if you test more, you find more cases. One of the hot spots has been New York State, as you know, where I think a quarter of the cases, so well over 250,000 cases, are in New York State, New York City being an epicenter of that. And they've done a lot of testing in New York City, and they're quite confident. Governor Cuomo is quite confident that 25% of New Yorkers actually have the COVID antibodies. So it just tells you how quickly this disease can spread. It's very easily spread. And of course, as you know, as Italians know, you can be asymptomatic and pass on the disease without even knowing it, which is part of the problem. So in the United States, the political debate, because everything is political there in an election year, with November coming up fast, President Trump has, he doesn't want the economy closed. He wants the economy reopened. He doesn't want all the unemployed. He wants people employed again. He doesn't want the government spending trillions of dollars. He wants the economy to be restarted. So he's been pushing pretty hard the states to reopen the local and state economies. Now you're getting a patchwork happening where some states like California and Michigan are very much still closed. Governor Cuomo in New York still wants New York to be closed, particularly in the hardest hit areas. And then you've got other states like Florida and Georgia, Texas, that are anxious to reopen and to get back to some sort of economic normalcy. So that's the nature of the political debate in the United States at the present time. I hope that answers your question.
Absolutely. Thank you very much. And what kind of impact can you imagine that the COVID can have on U.S. election this year?
That's a whole different game. Everybody's playing. Everybody wants to play that game. What the impact is. I think there's polls that have been released. President Trump's initial favorabilities went up. They've declined somewhat as the pandemic has continued. I think one of the reasons Trump politically wants the economy opened is because he wants not to have to fight an election with a with an economy that is in such grave danger. So I think that he really does want the economy open for those political reasons as well as for the public policy reasons that are important. I would just say to outside observers such as yourselves, when you see a national poll done in the United States, it makes no difference. It's not relevant because the United States election is decided state by state. So if Joe Biden has a 10-point lead, that's irrelevant because he might have a 40-point lead in New York and a 50-point lead in California, which are never part of the Republicans' calculations of states that they have to win. What you have to look at are states like Pennsylvania, Florida, Michigan, Wisconsin. These were states that Trump improbably won in 2016, much to the dismay of the Democrats and the media establishment, if I can call it that, mainstream media. And in those states, Trump is behind, but he's not behind by a lot. And I think it's maybe 8 or 10 points in some states, less than 3 in Florida. I think 8 points in Pennsylvania. Easily, he can catch up with those kinds of numbers. So I think he's going in with some strengths, but the economy has to be in better shape for him to be confident of victory.
Thank you very much. So, guys, feel free to ask questions.
Yes, if I can, one question from myself. Good evening. This is Enrico Rigini speaking. I'm from Madrid, but I'm a good friend of these other guys. So
Great.
I had one question for you, if it's possible. It is more related just to the possible economic impact of this COVID crisis on the Canadian GDP. So what is your personal opinion? How is the government reacting? I mean, was any kind of specific action put in place, like something similar to the US, or I mean, the government should have done something more? And also, based on your experience, what will be necessary to do in addition to the current measures or action that have been put in place by the government? Thank you.
Thank you. And I should have mentioned, of course, in Canada, we have the same economic shutdown. Non-essential businesses have been ordered closed, physical distancing, parks are closed, no sports, no live entertainment, and so on. It's the same around the world. So that part is the same. There has been wage subsidy for those who've lost their jobs through government efforts. There was just a new report by the Parliamentary Budget Officer. We typically, in the last, let's say, 5 or 6 years, the federal government, the national government has had a deficit between 10 and 30 billion dollars, Canadian dollars. The deficit for next year will be 250 billion dollars. So it's gone up by a factor of 10. So that report just came out today by the Parliamentary Budget Officer, who's an independent source, and it obviously that's very concerning for us who are deficit hawks. It just really reinforces the need to restart the economy as soon as possible. We have a double whammy in Canada because part of our economy, a significant part, I think it's 10 or 15% of GDP, is reliant on oil and gas production. Well, I don't have to tell you about the oil and gas market right now. And this is focused in the province of Alberta. So this poor province, which has, I'd say 10 or 15% of the Canadian population, they not only have COVID, but they have their major industry, which is, 30 or 40% of their provincial GDP is in oil and gas, and it ain't moving anywhere right now. So they're in great distress. They were in great distress before COVID hit, and it's only been reinforced by the OPEC drama and the lack of demand for petroleum products, etc. So not good on that front. In the month of March, Canadian GDP declined by 9%. So I think obviously April's not going to be any better than that. It's going to be worse than that. And because our lockdown started March 16th. So half of the month of March was in lockdown, but all of April, obviously. Yeah, I think we're in territory that we've never seen before. When I was Minister of Industry during the financial crisis, 2008, 2009, obviously we were under economic distress then as well, and the world was. There was a hit to the global economy, but this is of a magnitude that none of us have ever seen in our lifetimes. So yeah, we're all grappling with it, and I wrote an article for one of the major national newspapers, the Toronto Globe and Mail, saying, we just have to have a plan. I'm not saying tomorrow open up, but let's start working on a plan to open the economy. Otherwise, there's going to be a lot of distress for a lot of people, for sure.
And also, if I can ask, in terms of unemployment rate, what are you expecting?
I don't have the exact numbers on unemployment, but I think the applications for government assistance, whether it's business assistance or individual assistance, I think it was like 10 million applications. So it's like that's a third of the country.
Huge number.
Yeah,
huge number.
It's never been seen before. It's totally unprecedented. We're going through times we've never experienced before, and now I'm a big believer, ladies and gentlemen, that what we have here unusually is lack of supply issues versus lack of demand. The demand is suppressed, but if we could get the economy moving again and supply would be available, I think we could bounce back quite quickly. I'm not saying a V shape, but closer to a V than a U. But that's my theory, and I think supply is also going to be an interesting geopolitical issue as countries start to figure out ways to get their supply chain away from China.
Yes.
I think we've all realized we are a little bit too dependent on Chinese supply chains. We have all the personal protection equipment challenges because like 99% of it is manufactured in China. So that's come home to roost. So I do believe that over the next years, there's going to be a big shift in supply chain logistics. But for the time being, we're just trying to kickstart our economies.
Yeah. Thanks a lot.
So next question.
Me.
Ricardo wants one.
Me? Okay, go. Let's go.
Okay. My name is Riccardo Perrone. Thank you very much, Honorable Tony Clement, for participating to this WebEx meeting. I would like to ask you a couple of things. First of all, if there is a nice relationship of cooperation between the government, the Trudeau's government, with the opposition, if basically ask if Mr. Trudeau is eager to accept suggestions from the opposition.
I think I lost you there.
And if those are taken into good consideration.
Ricardo,
also, yes.
Can you hear us? Because we can hear you. Maybe leave the meeting and join again.
I think the question was about cooperation between amongst the opposition parties and the government. Was that the issue?
Yeah, I think the issue was that, but then we lost him. So yeah, now I don't see it disconnected, but I think now.
Yeah, he's rejoining.
Now he's rejoining, but yes, if I correctly understood, it was about cooperation between political forces.
Yeah, and if I can answer that in the absence of Ricardo, sorry, Ricardo.
For sure,
we'll keep the train running here. Yeah, it's actually been quite surprising to me that there hasn't been more cooperation. There's cooperation between the national federal government and the individual provincial governments, which are of different political stripes. So, for instance, in the province of Ontario and in the province of Quebec and in the province of Alberta, all three are run by conservative premiers. Obviously, Mr. Trudeau is a Liberal prime minister. And the level of cooperation has been high, and the premiers have resisted the opportunity to have publicly stated opinions on how well or poorly, specifically how poorly Trudeau is doing. They've all said he's doing well, we're working together, we're cooperating. Nobody wants to be, to use a North American expression, the skunk in the garden party. I don't know if that translates into Italian at all, but that's a good North American expression. Nobody wants to be the skunk in the garden party. So that part has shown incredible cooperation between different levels of government. In the national parliament, there's been very little cooperation. The opposition parties have demanded a seat at the table because this is a time of national crisis, and they have not had a seat at the table. They've had to demand and stomp their feet. Parliament was recessed in the middle of March at the beginning of the crisis, when human-to-human transmission was obvious, and then they had to yell and scream to get Parliament to sit again. It sits for one day a week with a much reduced cohort of parliamentarians, and then a couple of days a week they have teleconference parliamentary sittings. But literally, the Liberal government had to be dragged kicking and screaming in order to allow that to happen. And opposition parties are not involved in any of the announcements or the crafting of the policy. So now, the interesting thing is we have what we call a minority parliament, what the British call a hung parliament. The Liberals do not have a majority of seats. So there has been some negotiation over specifics of the economic measures. Those are the only measures that are being brought forward to the Canadian Parliament. And there have been changes to those measures as a result of political negotiation. But that's kind of the lowest level of cooperation you can have, because you need that cooperation in order to get anything passed in Parliament. But I would not say that Canada has been a shining example of multi-partisan cooperation. Let's put it that way.
Thank you very much. It's similar situation here in Italy. We are not a good example about cooperation, not at all.
Ludovico, actually, I had another question for the Honorable Clement.
Yes, but we cannot hear you very well.
Okay.
Try now.
Can you hear me now?
A little bit
robotic, but
can you hear me now? Okay. Basically, I just want to ask about the medical care. The medical treatment of COVID patients, because about a month and a half ago, Trump made an announcement that there was this successful recipe for medical care of COVID patients based on hydroxychloroquine, Zithromax, and zinc, which was basically this kind of a cocktail of pharmaceuticals was engineered and tested by a Jewish medical doctor in Long Island near New York, and then there are basically some discordant feelings and news about this, because we hear in Italy, in France that was very successful, but then some American sources, they're spreading the news. I don't know if it is fake news or not, that this treatment is toxic. And actually, it is very strange from a pharmaceutical that was introduced 70 years ago, and it was very well tested then. And so what is the treatment that it is used by Canada, the medical treatment for COVID patients?
Yeah, so obviously Canadians watch American news because we're right next door, and we see the news conferences and all these reports, and we're all waiting very patiently for some degree of consensus on the way to go for treatment as well as vaccine. The two are separate, but there's a lot of medical research being done, Canadian research as well. I think the Canadian government has put in $2 billion for vaccine research, just announced it a couple of days ago. So in terms of the treatment of COVID patients, I think that they are, and I've heard other theories, but I think the basic theory is treating it as a respiratory ailment. So that's why there was that high degree of demand for ventilators, as an example, and so that's how it's being treated. Now, I've heard alternative theories that it may not be totally respiratory. There's this new report that some people are having, younger people are having strokes, which makes it a circulatory issue, not a respiratory issue. I'm not a doctor, so I don't know. But in Canada, it is treated basically as a respiratory ailment, and ventilators are used in extreme situations.
Thank you very much, Maria Vittoria.
Hi, good evening, Miss. Can you hear me?
Yes, I can.
Okay, good evening, Mr. Clement. It's Maria Vittoria Marocco speaking from Turin in Italy. It's a pleasure to have this conversation with you, and we really appreciate your availability to talk with us. We want to thank you. So I would like to ask you what could have been the best way to act as a conservative leader, thinker and politician, and how would you have acted if you were still the Minister of Health?
Thank you for the question. It's a question I get a lot because I was a former National Minister of Health and Provincial Minister of Health during SARS. And my answer, I try to give some grace to the actors who are making the decisions now. I know how difficult it is, how challenging it is to make these decisions in the midst of a crisis. In 2003, during SARS, I called it the fog of war. And I meant that it's very, very difficult decision making for politicians and public health people. My critique has been basically at the front end that we acted too slowly, particularly in terms of our borders. And, we didn't do anything about Chinese flights or anything like that. Now, I've just been proved wrong. Like they just came out with a report today that the great majority of COVID cases came from the US, not from China. So if I were a decision maker and I would have closed down the flights from China in January, it would have had no impact because we still have a porous border with the US. We call it the longest undefended border in the world. So I mean, when you're faced with that, I don't know what you can do. There's been some criticism that the PPE, the personal protective equipment, we should have had more stock. Yeah, we should have had more stock, and we should have learned from SARS and learned from H1N1. But we would have any stockpile we would have had, we would have gone through in 2-3 weeks. Nobody's going to be stockpiling for months. In anticipation of a crisis. So I agree with the lockdown. Some people say we should have gone the Swedish route, the herd immunity approach. When you're a decision maker and everybody's locking down, Italy, when we made the decision, Italy was the headline every day, and Spain was just starting to be the headline. I would have locked down as well. Now, I think we have a genuine debate about how to get out of the lockdown. And Canadians are being very conservative about it compared to European countries like Austria, as an example, Denmark. And of course, the US they're doing their own thing, county by county practically. And what I've noticed is that the reason Canadians were given for the lockdown was to give our hospitals time to prepare for a massive outbreak. So that was the reason. So we said to everybody, stay home, don't go to your job unless you're an essential service. Go for walks, but don't hang around in the parks. All these sacrifices people were making. But now the goalpost has shifted. So it's not about the capacity in our hospitals. Our hospitals have a lot of capacity right now. It's about somehow being at a point where new COVID cases are a lot less than the current COVID cases. That's a different metric. I don't know if we'll ever get there. The politicians are deathly afraid of making a decision to loosen up and then a second wave coming. Well, folks, I think we are going to have a second wave. I don't think there's any doubt that this is not going away anytime soon. So, but now politicians are in a trap. I was referring to in another interview today to Colin Powell, who was the Secretary of State in the U.S. during the Iran-Iraq war and the invasion of Iraq. And he called it the Pottery Barn approach to politics. And Pottery Barn is a retail store in North America, and they have big signs. If you break it, you own it. Like if you break something in Pottery Barn, you own it. That's true for politicians. If you make a decision and something goes wrong, you own that decision. So all these politicians have made the decision to lock down. The politician who decides not to lock down and a lot of people die, they're going to own that. It's never going to be forgotten. So that's why the politicians are very reticent. They're very cautious about unwinding the lockdown. I understand that. But we also need an economy. We can't just be servants of the state. Eventually the money will run out. And so I think some politicians are going to have to be courageous and be upfront with people and say, look, this is a tough decision. We may have a second wave, but we've got to start working again. Start cautiously, still have physical distance where we can, all of those things. But at some point, you've got to restart the economy. So that's what I'm looking for in terms of leadership, not from the public servants who will never say that. And there's no chief medical officer of health who's going to say, let's start the economy. But politicians have got to say, I know we still have COVID in our country. I know there'll still be more cases. I know, unfortunately, there'll still be more deaths, but we also need to live and in an economy that works. So that's the next stage of the debate that I'm interested in.
Yeah, I think that they have to carry it on their shoulder and make decision. That's why we are looking for leaders, not for people that demand the decisions to others.
Indeed,
Thank you.
I agree. Yeah.
Gianmarco, next question.
Yes, good evening. My name is Gianmarco. Good evening. Thanks for the time you with us. I was asking me if it's true that what our Prime Minister Conte said, that is the world is watching us like an example. And I am a little bit confused. And I'm not. I don't think it's true. These things. I don't know if Canada are watching us like an example.
Yeah. Thanks for the question, Gianmarco. I think there's been a lot of interest in what's happening in Italy and Spain, but I think Italy more than Spain, because Spain was sort of after Italy in terms of the bell curve. So Italy really captured, it was, I guess, mid-March when things were really starting to happen in Italy. And it really captured the imagination of North Americans, because, Italy's a place we have a lot of affinity to Italy, and it's part of our civilization. And a lot of people have visited Italy. So when it happened, I think there was a lot of interest, and a lot of people were saying to themselves or to others, if that's our future, we've got to try to avoid all of that. And there's a high mortality rate. our elders were affected a lot in Italy, and so I think policymakers saw that and saw the concern of the public and said, okay, how do we avoid Italy at all costs? At that stage of the debate, which was 6 or 7 weeks ago now. I think that's quite true.
Okay, thank you. Thank you so
yeah,
much.
for sure.
Andrea, and I'm very happy Andrea Gabba is with us also because he's the founder of the Republican Observer, which is an online newspaper here in Italy, directed by youth. So I think it's great that he is with us. Andrea, please.
Thank you, Ludovico. Thank you also for participating, Mr. Clement. I wanted to ask, as you mentioned before, the China threat, what's the position of Canada regarding the 5G and the future trade relations after COVID with China? Thank you.
Thanks for the question. It's a real political issue in Canada. I know Italy is part of in some manner, the Belt and Road Initiative, which I find interesting. I think it's the only G7 country that is part of the Belt and Road Initiative. In Canada, very interesting debate. Firstly, Justin Trudeau, before he got elected, one of his many controversial statements was in answer to a question, before he was even elected prime minister, somebody asked Justin Trudeau, aside from Canada, what country do you admire the most? And his answer was China. And he said, I admire China because of their, quote, basic dictatorship. They can make decisions very quickly and efficiently. And we were lighting our hair on fire as conservatives, saying, "Why? Your answer is of all of the 192 countries of the world, you chose China as your." Anyway, so that was one of the things that we were on about with Justin Trudeau, and then bilateral relations with China have not been good. And part of it has to do with them holding 2 Canadians for 500 days now on trumped up charges of spying. These 2 men are in solitary confinement in Chinese jails, and that's been a very big irritant. And furthermore, there's the Huawei decision, the 5G decision, which has not been made. Canada has not made that decision. They didn't want to make the decision before the last election, which took place in October of 2019. And they, of course, now it's 2020, but they've got a few other things on their minds other than the Huawei decision. So that's still out there and outstanding. So there's a high degree of mistrust of the Chinese government amongst the Canadian population. We have in our Chinese Canadian community, I would say, a split where some are pro-Chinese and some are not. We have a number of Taiwanese Canadians as well, and Hong Kong Canadians. So very interesting internal politics within the diaspora of Chinese Canadians here. So all of that is to say it is a massive political problem. And of course, I don't believe the Trudeau government wants to rattle the cage of China just now, because of course they need the PPE, the personal protective equipment. And as I said, 99% of it comes from China. So it's a huge political issue. I would say of all of the foreign policy issues, other than Canada-U.S. relations, Canada-U.S. relations is almost domestic policy political issues for us. But in terms of foreign policy issues, China ranks number 1, no question about it. And the Trudeau government is seen as too pro-China. The health minister, as recently as yesterday, when asked, what do you think about the Chinese response to COVID? She defended the Chinese response to COVID and said, "Oh no, they did a good job, and they were very forthright." And that obviously is not what the media thinks nor what the population thinks. So this is an issue that is going to come back once this is over in some manner, in the new not so normal, as I put it. I think that Canada-China relations is going to be one of those hot potatoes for sure.
Thank you.
So next, Francesco or Enrico, I don't know who is next one. Victoria again? No, Matt.
I don't know. I can open the chat, so I don't know if there is someone that wants to ask something.
Let's go. Bye.
About what declared our prime minister, that told that if he was able to go back in time, he will act in the exact way he decided to act. So, what do you think about leaders that don't that think that they can't sorry, they're not able to admit that they were wrong and they took wrong decisions for their countries.
Yeah, I'll give you my honest advice on this. That's a bad communications decision by the leader. So we have a premier in Ontario. Ontario has the bulk of the Canadian population. It's about 17 million people out of 35 million, somewhere in that range. So our premier is Premier Doug Ford. He's a conservative. He was seen as a populist conservative. He's a big guy. He's like a bull. And so people said, oh, he's like Trump, and they didn't mean that in a good way. So, but he has grown in popularity. His popularity now is like 78% or something like that, because when he goes to his daily press conference, he just tells it like it is. And so I'll give you one example, and it goes directly to your question. So yesterday, it's become clear that right now, most of the issue is in our, as I said, in our nursing homes, our seniors' homes. So a reporter asked him, this is happening. Our seniors are dying in our seniors' homes. Do you take any responsibility for the state of our seniors' homes? Are you going to take responsibility? Now, he could have said, I just got elected last year. It's not my responsibility. Governments in the past should have done this and that. You know what he said? And he said it this way exactly. He said, yeah, that's on me. He didn't even say, yeah, I take responsibility. He said, it's on me. And that's the colloquial way of saying, I'll take responsibility. And it's like, okay. I mean, nobody could find fault with that. Now, he has to deliver better seniors care in the years to come. But his attitude is like a breath of fresh air. People who hated him, and a lot of people did before COVID, he was making cuts to budgets, and the unions were getting upset, and Doug Ford doesn't care about our kids, blah, blah, blah. People like that are now saying, I used to hate Doug Ford, but he's doing a really good job. It's unbelievable, the turnaround this guy's had, just by the way he takes responsibility. It's no baloney, no BS. It's just straight, here's what's happening. Yeah, I'm responsible for that. I'll fix that. Yeah, I'm frustrated with that. He was frustrated with the testing. The testing was not happening quickly enough. He said, yeah, it should be happening quicker. We got to do a better job. So, and the interesting thing is, from a Canadian perspective, because 90% of the Canadian population doesn't like Donald Trump, right? So if you're compared to Donald Trump as like you're like Donald Trump, that's not a good thing in Canadian politics. Even if you're a conservative, even conservatives don't like Donald Trump. There's a slice that do, but there's a big slice that don't. So people were saying they were comparing Doug Ford in the press conferences to the way Donald Trump is. When I don't know where you stand on Donald Trump, but here's the point. The point is, he was asked, Donald Trump was asked this week, do you take any responsibility for the fact that people are ingesting disinfectant more after you said that disinfectant could be, should be used? He said, no, I don't take responsibility for that. It's not, I have no idea why they're ingesting disinfectant. So that's Donald Trump's approach. Now, Donald Trump is a unique politician in the world. His method of communication is unique in the world. He gets away with stuff that other politicians would never get away with. So let's put Donald Trump aside, because he plays by his own rules and is measured in a different way. If a Canadian politician would have said the things that Donald Trump said, they wouldn't be in politics for very long. But my point is, Doug Ford in the Canadian context is now a national hero because he's saying it exactly the way he sees it. And when he takes responsibility, unlike the gentleman that you mentioned, he's taking responsibility. And even when it's not fair to for him to take responsibility, he's not the sole reason why our elder care facilities are in bad shape. But he says, yeah, it's on me. I got to do a better job on that. So, I think there's a lot of credibility you can gain as a politician if you connect with people and people believe that you're suffering along with them, and there's nothing more powerful in politics than that.
Okay,
so can you help us to organize a call conference between the Ontario Prime Minister and our Italian Prime Minister? I think it would be useful, because we have the exactly opposite situation here in Italy.
Yeah.
It's not good.
Yeah.
No, I know politicians can feel like if they apologize for something, then they own it. I was talking about the Pottery Barn, but there's something to be said for going the exact opposite route, and people find that very refreshing. So maybe that should be arranged.
And also, these are not normal timings, not normal circumstances. So
Exactly.
It makes sense to be honest. And if I can ask also another question from my side, what do you think is going to be like the reshuffle, I would say, in terms of on a geopolitical level, in terms of relationship, like between what we call like Western world and China? I know you were talking before about the good relationship between your prime minister and China, but what do you expect in the next forthcoming years? Because it seems that Europe is a dream. I mean, is a dream that is collapsing, and so most of the countries are now like in a difficult situation, or they are like against this idea of European Union. So Europe might also turn into like a kind of land where big countries can once again start fighting one against the other one. I don't know, what is your personal opinion with respect to this?
Yeah, that's a whole topic in and of itself, of course, and thank you for that. I would say a couple things. First of all, I see, not just me, others see, really the COVID accelerating something that was already happening between China and non-China. So, you were either part of the Belt and Road Initiative or you weren't. So that's one division in the world. You were starting to see that in technology as well. You were part of the Huawei 5G or you aren't. So, which technology are you going to be with, the non-China technology or the China technology? So you're seeing that division in the world. I think you're going to start to see supply chain division as well. You either continue with the Chinese supply chain or you don't. And if you don't, there'll be a rebuild of the supply chain. Vietnam might be part of that, and Mexico will be part of that, and South America will be part of that, and Europe will be part of that. So I think that supply chain over the next few years. So really, we're getting into a duopoly world based on China's economic prowess or not. So I think that's part of it. The other part of what you said, I look at it this way. When we had the Great Recession and the financial crisis, let's look back to 2008, 2009. What happened? The world got together through the G20, and they made a series of massive economic decisions, and they coordinated their fiscal and economic policy through the G20. Right? That's what happened. And the European Bank was part of that, along with the US federal bank and the Canadian bank and whatever. Massive coordination. Let's fast forward to 2020. What's happened? Nothing of the sort has happened in terms of international cooperation. There's some research scientists that are working collaboratively on a vaccine. That's it. Overwhelmingly, the response to COVID has been country by country. People have looked to their national government. The national government has taken action or not, but mostly taken action. And it's not as if we're looking to a multilateral institution like the World Health Organization or the United Nations, or I dare say the European Union. It's all, to me, it's all back to, we're all back to Westphalia here. We're all back to the nation state as the primary source of protecting us from this crisis. So that leads me to conclude that trend, which is obviously not a globalization trend, it's the reverse of that, is the trend that was started before this all happened. You can look to Brexit, or you can look to Trump, or you've got similar political fights in Italy and elsewhere. I just see that trend accelerating, because COVID, again, was the example where the world couldn't figure it out together. Italy had to look after Italians, and Spain had to look after Spaniards, and Canada had to look after Canadians. And of course, the next way it's gonna manifest itself is when there's a vaccine. If there's a vaccine, and if that vaccine is created in the United States of America, do you honestly believe that Donald Trump is going to give that vaccine free to the rest of the world before he's vaccinated every single American? I don't think so. And so there's going to be a huge political crisis if the vaccine is created in America. There's going to be a huge political crisis if the vaccine is created in China. I see this coming down the pipe. So hold on, because more of this type of movement away from globalization is just starting to accelerate, in my view.
Thank you very much. I agree. Totally agree. Marco,
Yeah.
you have a question?
Yeah. But first, I want to let you
Please
notice
go.
that Tony spoke about personal distancing and not about social distancing. It is a different stuff. But my question is, I'm too young to remember SARS pandemic, and I don't remember, honestly, because I was too young, if the international organization like WHO were so confused about, for example, today we receive a lot of different messages, like the mask is totally useless at first, then we understand that mask can be useful, and then we need to use mask. So I don't understand. This is the first time we are so confused. The international organization are so confused. What is always happened, also with SARS.
Yeah, you're quite correct. I do not recall the World Health Organization being all over the map with SARS as they are with COVID. The one thing they did that I had to reverse was they put a travel advisory in for Toronto, and I had to fly to Geneva and convince them to lift the travel advisory, which they did do. Gro Brundtland was the Secretary General of the WHO at the time. You may remember her as a former Prime Minister of Norway. Then I don't know why she became Secretary General of the World Health Organization, but she did. And the other controversy at the time, which I'm sure sounds familiar, was there was pretty good evidence that the Chinese sat on knowing about SARS, in that case, for at least 3 months before they informed the WHO that there was a new novel coronavirus which eventually became SARS. So, and so there was some criticism of WHO at that time for not being on the ball and recognizing what was going on in China. So you can disagree with some things with President Trump, but I do agree with him. I'd put it this way. I think there has to be a real endeavor by national governments to have a better control over what happens with the World Health Organization, and to make sure that they are not, beholden to Chinese interests or what have you. I led a fight when I was National Health Minister in 2006 to 2008. I led a fight to get Taiwan at least as an observer status. I said to the World Health Organization, look, epidemics know no boundaries. You've got to have Taiwan as part of this organization. This is not a political issue; it's a public health issue. And I actually got Taiwan on as an observer to WHO, and then I was no longer health minister, and they got dropped from WHO shortly thereafter. But this is not the place for that kind of politics, obviously, in my view. But there has to be a real rethink at the World Health Organization.
Yeah. Also, our Senator Lucio Malan, Senator of the Republic, made a statement about Taiwan, because Taiwan is helping. Taiwan as a method to control the pandemic, and WHO is not allowing them to.
No, they're persona non grata. It's very sad and very unfortunate. I agree.
Yeah, maybe Ludovico. Wait.
Yes, I think there is another question by Ricardo, and then maybe we can go to a conclusion. But Ricardo, please go.
A very last question. Passing from WHO to WTO, World Trade Organization, in my opinion, my personal opinion, the cause of this spreading of COVID-19 from China to the rest of the world so quickly maybe could be because China is a recent member of the World Trade Organization. And according to my information, it was Hillary Clinton who allowed China to enter in the WTO. Do you think that after this COVID crisis, there are going to be some changes in the WTO? I mean, are the major countries going to permanently organize in order to discard the manufacturing in China of their principal goods, and so basically to take control of their national manufacturing and production, and maybe kick out China from World Trade Organization?
Yeah, great question. I hadn't thought about that angle, but I do see what you're saying, Ricardo. I would answer it partially, at least, this way. I think we've got some very strong messages coming from not only President Trump, but also Mnuchin, who's the Treasury Secretary, Lighthizer, who's his trade advisor. They, even at the beginning of this crisis, were saying, look, this supply chain has got to be turned around here. We can't all be beholden to China for our supply chain. I know for a fact that this kind of conversation is happening on various fronts. So just by virtue of my work, some of my consulting work, I know that countries are looking to create an organization on critical minerals, as an example. This is before COVID, where minerals that are used in defense manufacturing and other strategic manufacturing, make sure that the Chinese are not cornering the market on critical minerals. That same kind of logic, I predict, is going to then fan out into other areas of the economy where it's going to be determined that the Chinese have too much influence over the supply chain. It's got to be broken up so that that we're not, we're not put under the gun before again. So I do think that's, whether that's WTO or whether it's some other multilateral leadership, and whether the U.S. is leading that, or somehow it will have to, that conversation will occur. And I do believe the Americans will be leading that, either above the scene or behind the scene. It's very clear, as I said, from the Treasury Secretary and the trade advisor to the president, that they see this as, if he gets reelected, they see this as part of their agenda.
Thank you. Thank you very much for your answer.
Yeah.
Thank you. Thank you, Mr. Clement. And
for sure.
Any questions? Any more questions? Guys? Okay, so I think we can end the webinar, and it was really interesting. Thank you very much again, Mr. Clement. It was a pleasure and an honor for us, and trying to better understand what's happening in North America.
For sure.
So I hope you can join us physically when the COVID emergency will be over. So maybe you can be our guest physically here in Italy in the future. And
I would love that. Thank you.
Thank you very much, and thank you, Marco. If you want to end the meeting, thank you, Mr. Clement, again.
Thank you. Thanks for the opportunity. I really enjoyed it.
Thanks a lot.
Yeah.